So just a bit of housekeeping. My name is Jo Tonkin. I'm the Deputy Director of Public Health in Birmingham City Council, and I'm kind of hosting this initial webinar. What I would ask you to do is throughout the webinar, please stay muted. Please turn off any VPNs to save bandwidth. Please use the chat function to ask questions or raise your hand and we'll then kind of respond. We're going to have questions at the end of the session. For your information, this webinar will be made available to those who can't join us. So today's webinar will be recorded. The recording, both audio and visual, will be available on Birmingham City Council's online platform. So just to kind of update, this is the structure of this opening webinar. I'm going to talk a bit about the conference, its aims, and then I'm going to pass over to first Councillor Thompson and then to Councillor Brennan. I'm going to kind of pick up the conversation and just talk a little bit about public health before moving on to give you a taste of the programme and then open up the conversation for questions and for reflections. So just by way of kind of introduction, this conference is as part of Black History Month, which for us provides the opportunity to share our commitment to addressing inequalities that rise from discrimination and from racism. Public health is focused on promoting and improving and protecting health and wellbeing and reducing inequalities. So in this series of webinars, which celebrates Black History Month, we shine a light on inequalities in health experienced by Birmingham's large and diverse Black, Asian and minoritised community. We celebrate communities with shared experience of migration, of discrimination and racism, and celebrate their ability to overcome barriers, coming together to challenge and change professionals and institutions. My colleagues presenting the work from across public health and the health system will provide evidence on emerging practice, which will inspire us all to do better and to examine our own and our organisation's practice. We invite your questions, your feedback and opportunities to further disseminate this learning. And with that, I will pass on to Councillor Thompson.
Thank you very much. So first of all, it's great to see everybody that's joined the webinar today. I hope you've all brought your lunch with you. I just want to say welcome, first of all, to the start of Birmingham's Black History Month Health Conference 2023, which is titled Global Communities, Local Challenges, Partnership Solutions. And that's a huge remit, but one that I know we can all take up the challenge moving forward, not just for Black History Month, but throughout the whole year. But this is an exciting month for us because we're really lucky that public health, alongside other partners across the council, have managed to put on an exciting programme for us that's over 20 webinars to share learning and celebrate our diversity and vibrant ethnic communities as we tackle the health inequalities together as a collective. But given that this is Black History Month, it will be amiss of me not to talk a little bit about the theme of Black History Month across the country, which is saluting our sisters. So for all the sisters that are on here today, I just want to extend my thanks to you for everything that you do and salute you for everything that you're doing throughout Birmingham City Council and the wider part of the city, because you contribute massively to everything that we do. And also to our allies and supporters that also support us at the same time, thank you for your ongoing allyship. And together we can make Birmingham a much better, brighter, vibrant place for everybody across the city. Now, Birmingham is a diverse and vibrant city, and I keep saying this because I say it with so much pride, because I absolutely love this city. And it's one of the brilliant things about the city is its diversity. When we can come together and celebrate where we've got more in common, but at the same time, we can look at the differences and celebrate and enjoy each other's cultures at the same time. Now, that can include creativeness, it could be food, heritage, the business sectors. We thrive absolutely everywhere. Now, whether you're a fan of noodles on Chinatown, whether it's a curry on the Lady Pool Road, or whether it's somewhere from a Polish supermarket by Snow Hill, this city welcomes everybody. And I will, of course, shout out and make reference to, if you're interested in curry goat and rice, or whether that's jollof rice or anything else from an African dish, we thank you and celebrate with that. And for anybody that has good restaurants that you know of, please feel free to email me, because I'm looking for new restaurants to go and challenge and try out across the city. Now, our city represents 51.4% of ethnic minority communities at present of the Birmingham population. So that's more than half. And that's making Birmingham one of the first super diverse cities in the UK. And with that comes great pride, but it also comes with great challenges as well. We are the home of people from over 187 different nationalities, which is one of the things I'm particularly proud of. But also, it's just great to have so much diversity in the city where children can learn so much about different cultures and different communities. And I think we've all got a responsibility to play in that, in making sure that we share some of the great things that come from all of those different nationalities that are placed here in Birmingham, in the city we live and we love. Now, our understanding of the concept of ethnic identity is continually growing at the moment. In a city the size of Birmingham, with over 1 million people, we have to go beyond the shorthand brief of BAME. That's one of my pet hates when it comes to that term, because I think we need to respect every single culture and walk of life that's contained within that framework. So that's whether it's you're Black, Asian, whether it's a different ethnic minority community that you come from, we have to understand the differences. And I know that from my own communities. So I know there's a huge difference in culturally and sometimes the food that we have when it comes to the Caribbean community compared to when you come from a different African continent, whether it's Nigeria, Kenya, or somewhere else like that. And it's the same for other ethnic groups that are residing in Birmingham. So we mustn't water down the true differences between everybody that resides here, but we must celebrate and actually take an active view around understanding the differences and respecting those differences from different communities. And that's why I'm so proud of Public Health. Don't tell the rest of the council I'm proud of everyone, but I'm so proud of Public Health for the way that they've really led the way across the council of understanding the differences between communities, because that is so vital and so important, and it means a lot to us. So just as an example of this, you would have seen the work that took place with projects that have happened in, I think it was with, was it in Lewisham? Was it Lewisham? Yes. It was a joint project between Birmingham and Lewisham, and it looked at the community health profiles and looked at the complexities of ethnic minority groups and what it was like in terms of those inequalities, and really understanding what that meant. And once you get to that point of understanding the data, understanding the culture, understanding the communities, that's when you have a genuine opportunity to actually start to address inequalities. And that's one of the things that we've been pushing forward on this. And I would just like to give a shout out to two sisters who have been involved in some of this work. And that is my cabinet colleague, Councillor Mariam Khan, who is leading on the public health agenda in terms of from the political perspective, and also who is now the MP for Erdington, Paulette Hamilton, who also was instrumental in making sure that this happened before she left the council and went on to pastures new. But of course, there's a stream of officers that have taken the lead on this. And one of the things that's been so important that made this programme so successful was that the leadership came from the top of those that were driving this forward. They were keen to be curious. They were keen to understand and actually lead from the front. And that's one of the reasons why this particular programme has been recognised recognised, not just here in Birmingham, not over just in London, but has been recognised across the country as good practice and is one that gets nominated for awards. So once again, I just want to give a shout out to everybody in the council that has contributed towards that and have taken a genuine approach in making sure that we get the best understanding and genuinely support communities from a pure place and a pure heart, because that's what really matters. And again, as I've said, I hate the term BAME, I have to confess, because it's not just good enough to merge that all Black people are from one humongous group. That is so not true. The idea that the Egyptians and Nigerians and the South Africans all share the same belief, the inequalities and experience is disrespectful, to be quite honest, and it needs to be challenged. We have to recognise the differences. We have to be prepared to listen to the voices, but at the same time be prepared to change and be challenged. And if we're not prepared to change and be challenged, then there's no point in coming to the table. Step aside and let someone else move in who is prepared to do those things. So I also want to recognise the level of recognise and reflect actually on the changing demographics across the city, with almost 20,000 people migrated to Birmingham from abroad in 2020 and almost 80,000 migrated over a decade ago. That means that the experiences, the life chances of children are completely changing. I'm of an age, I'd like to say I'm not, but I'm of an age when I've seen huge amount of changes, and actually the opportunities for me, the understanding is completely different to what it was when my mum first came here to settle in the UK all the way from St Kitts. So it's about that generations of learning moving forward, making sure that we don't dilute people's culture and heritage, but we also help them to enhance and share. So again, we go back to that point of having that understanding, but also giving people the autonomy to make sure that they can still live their lives in Birmingham in a very way where their culture and practices can be carried out in a way that's not looked down on, frowned upon, or anything else like that, that we can all bring our authentic selves to work, to our social lives, to everything that we do across the city, and that it will be embraced and not be challenged in a negative way. And when things are challenged in a negative way, we have to be the ones that are prepared in a very sensible way to call that stuff out. And that's why I'm really pleased that this is taking place, because one, to celebrate and recognise, but at the same time to give us an opportunity to challenge people's perceptions of how other people live, what inequality looks like, the way that we are as a set of people, and also recognising that we have different layers to our identities. So, you know, it's not just the fact that you're an ethnic minority, you may be a woman, you might be from the LGBT community, you might have a disability. I'm dyslexic, people know that, it's on the bottom of my footer. All those things means that we have to sometimes make sure that we adapt the practices that we have to fit in and help people to thrive in the way that we would want them to do, and the way that we would want to thrive. We'd want our children to thrive and our brothers and sisters. So one of the things I always say is that if you are from an ethnic minority group, please, this is one of the most important things. As much as we want people to be an ally, you have to be prepared to be a good ally yourself. And that's why it's important that we're learning about different things that will challenge our own views and our own concepts. Now, we know that we talk about the celebration, and we saw last year, although it feels like a long time ago, the Commonwealth Games was a beautiful experience for the whole of the city. Yes, we managed to import the sun and the weather all the way from the Caribbean, I would like to say, but we had a great time. But the most impressive thing was the people of Birmingham and the way that they embraced everybody that came, and understanding and celebrating and just enjoying other cultures. I had the opportunity to speak to so many people from different countries who were a part of those athletics teams, or they were participating. And one of the things they said was great was the fact that even though they'd come so far from home, they still felt welcome and they still felt at home. And that was because of the people of Birmingham being so welcoming and so supportive. And that's why it's so important, as I keep saying, that we keep moving on in the vein that we are an inclusive city. But again, To be an inclusive city, we have to be brave, we have to be bold, and we have to be prepared to challenge certain things within the system, within around inequalities, and really go back to basics. And one of the things, again, I applaud public health and some of the other areas across the council for is the way that we're starting to draw on the data to really understand the differences and where inequalities sit, whether that's geographically, whether that's to do with age, whether that's to do with communities. And that's why it's so important as well that as an authority that we continue to operate as a really good collaborator, which means working with the health profession to understand the health inequalities and understanding how we as an authority can complement the work that they are doing. So I just once again want to say to everybody, I hope you have an amazing Black History Month. I will. I hope you get to attend as many things as possible and share so much about your own culture, but also understanding about other people's cultures. And if you've got a bring and share food to work, please remember to invite us from the cabinet, because we love to taste different foods from across the country and across the world. So we'll look out for those invites. But just again, just a quick plug, I need to know where I can get good, authentic African food from within the city, because I've yet to find one that has been recommended. So please feel free to send that to my inbox and enjoy the rest of the month. And once again, congratulations to everyone that's been involved in pulling together this webinar today, but also the subsequent 20-odd webinars that we've got going out throughout the month. Enjoy the month, and remember, it's more than just about 30 days. It's about understanding, and together we can address the inequalities of health in this city if we all pull together and understand each other from a better baseline. Thank you very much. I'm going to hand over to my fabulous colleague, Councillor Nicky Brennan.
Thank you, Councillor Thompson. It's always such an honour and a privilege to work with somebody so passionate about our city and equalities, and Birmingham are so lucky to have you as our Deputy Leader. And I'd just like to echo your thoughts and words. As the Councillor for Spark Hill, I love the vibrant diversity of our city and spend a lot of time exploring and learning about different cultures through the shops we've got on the Stratford Road and all the wonderful communities that make my ward so special and extraordinary. As the Cabinet Member for Social Justice, Community Safety and Equalities, I really welcome the breadth of discussions we will have over the next month, and I hope to join several of these sessions to add to my own learning as well, because we all have so much more to learn. Birmingham is a city of sanctuary, and it's something that I am so proud of and I love about Birmingham, because as a city of sanctuary, Birmingham is committed to welcoming those who come to us fleeing discrimination and hate. And given some of the recent unhelpful language we have heard around this lately, I just want to take this opportunity to reiterate the commitment and to say that as a city, we welcome women and LGBT people fleeing discrimination and violence. And it is important for us that we don't add to their burden by creating new hierarchies of hate. As Cabinet Member for Community Safety, I am also all too well aware of the role of racism and hate crime in causing fear and inequality in our city, and I am committed to challenging this and addressing it. We need to recognise that this isn't just okay. It shouldn't be tolerated as just part of someone's job or just what happens. There needs to be a zero tolerance approach to this. We have clearly set out our commitment to improving as a council inequality. Sorry, my cat is trying to sit on me at the moment. Sorry. Let me just get my point across while I push him off. We have clearly set out our commitment to improving as a council inequality, diversity and inclusion through everyone's battle, everyone's business. This sets out our commitment as an organisation to work to be better for all of our diverse staff and our diverse communities. This isn't a quick journey. It's not one with shortcuts either, and we all respect that. It also isn't an easy journey. It's a journey for all of us to be part of and take ownership of. We need to spend time working with our staff and our partners and our communities to co-create sustainable change, not just smooth over the cracks with some nice words and some changes with images on posters, because frankly, that is not good enough. We also know that it's not good enough to suggest that just a 1 hour e-learning can teach us how to be culturally competent, and we need to go deeper into the exploration of identity and how best to support our staff and citizens in the brilliant diversity that we call home. Some of the work that I know that will be presented over this month, particularly by our public health team, will share the journey we are on and some of the progress being made. But this is a journey that will take years, not weeks, to change. We are committed to making it something that fundamentally changes the council and improves the lives of all of our citizens. Thank you.
Councillors Thompson and Brennan, thank you so much for your inspiring, impassioned input. It's a great privilege to have you here at this opening webinar. I'm sure you've got extremely busy diaries, but it demonstrates the commitment that you have to this agenda. So thank you so much. Unless there are any specific questions to the councillors, I'm going to move on and just present a few slides in relation to public health and why this agenda is so important for us. Thank you, councillors. Can I confirm if you can see my slides?
We can, yes.
Yes.
Brilliant, thank you. And are we on the opening slide, or are we on the pink slide with Councillor Brennan's name on?
You're currently on the pink slide, but it's not in full screen.
Brilliant. I hope it is now.
Not yet. Not quite full screen yet. Perfect.
Brilliant. So I just want to do a brief input around public health and why this agenda is so significant for public health, and just kind of to introduce or remind colleagues what public health is. So it's defined as the art and science of preventing disease, prolonging life and promoting health through the organised efforts of society. So we work to reduce death, disease and disability, but by working in collaboration with organisations, the community, with individuals. We share meaningful information, sometimes data or evidence, but also the real experiences of individuals and communities, and work with them to enable them to identify their own solutions and make sure that these solutions are communicated widely across multi-sectors and taken account of. Public health is complex and takes not just a public health team in the City Council, in the region or at national or international level. It's achieved by us all working together. So much of our health and therefore public health work is shaped by wider determinants of health. It's estimated that 80% of our health is determined not by individual factors, ones that we can do nothing about, or necessarily by access to health services, though this is important, but by wider factors which can have a positive or negative impact on the health of individuals and communities. There's a couple more things to say about this. These factors can be cumulative. So how is it to have poor living and working conditions, perhaps being denied access to good quality housing and employment as a result of racism or discrimination, to have poor sanitation, to be socially isolated, to smoke? And how does this compare to living in good quality accommodation and working conditions, have good sanitation and to not smoke? Clearly, if we line up all of these benefits, protective factors, we're going to have a bigger positive impact on individuals' health and well-being. And the other thing to say is that it's easier sometimes to make the link between some of the wider determinants and health outcomes than others. So water and sanitation, damp housing, we can see that these will create opportunities for bugs which result in disease. But what about feeling unsafe in your community, being discriminated against or being victimised? Well, this rather complex diagram explains the impact of psychosocial stressors and how they impact on our physical and mental health, on how we act and how our body also reacts. It will be clear to those of us who've had an experience of adversity, often multiple adversity, and these are disproportionately higher or experienced at a greater level by minoritized communities. Being exposed to abuse, discrimination, bullying, particularly in the early years, has an impact on health, as does having a lack of control in your lives, being denied information, a failure to be heard or responded to, living in neighbourhoods which feel fractured, divided, unsafe, where there is violence in the community. These things impact on health, particularly on mental health and lifestyle factors like health harming behaviours, smoking, substance misuse and addiction. So how does this fit together with Black History Month and our programme of activity and events? Well, Black History is about understanding those inequalities, those health and social injustices. So you'll hear statistics, you'll see data, and you'll understand where improvements need to be made. But it's also about celebration. So you'll hear about how individuals, communities and organisations have built connections, built social support, resilience, self-efficacy, control and influence. And all of these things are health creating. They're protective and they buffer the negative impacts of adversity, of discrimination and racism. You'll also hear how groups and institutions are challenging and changing the way that determinants, including health services, impact negatively on health. And if that's whetted your appetite, my colleague Eloise, I think, has put a link into Eventbrite in the chat. We have speakers from Birmingham, from Wandsworth, and national speakers from the Office of Health Disparities, OHID. We're grateful for all of their time, but would particularly like to thank our Black clinicians, our speakers, for whom we have so much to learn, who are leading and highlighting these disparities. We have an e-poster competition. The application deadline has been extended, so thanks to everyone who submitted a poster, but there is still time to submit something. The deadline is now Thursday, the 12th of October. We hope as a result of this conference, we will have the e-poster, we'll have recordings of the webinar, which colleagues can access and disseminate. We will evaluate and we will reflect on the learning and the impact. We have lots to learn in public health and lots to do moving forward, so please be a part of that journey. So to summarise, the health of the population is dependent on addressing inequalities across all social determinants. We celebrate communities with shared experience of migration, of discrimination and racism, who are overcoming barriers, coming together to challenge and change professionals and institutions, to celebrate and involve us all in their culture and community. I hope, like you, I hope that you, like I, am inspired and appropriately challenged by the work taking place in Birmingham. I'm particularly grateful to all of those who have made a contribution to date. Thank you, and I'm happy to take any questions or reflections.